Simon, we should go. Good afternoon, everyone. Thank you for joining us on this beautiful Sunday. And I thank Dr. Hines, Dr. Walks, and Dr. Barbara Neighbor Stevens, and Dr. Lawson for joining us also. We're going to flip the script a little bit. Instead of talking about what doctors can do for you and what we health professionals know, let's talk about what you can do for yourself. So we want to talk about self-assessment and personal health examinations. I'm going to invite our co-host to assist me in these slides. Simon, go to the next slide. So why self-assessment matters? It helps early detection. It builds awareness of body changes. It supports long-term wellness and does not replace, however, medical care. It's very important. You must have a medical provider to provide you with advice. So I look at this like go to the next slide. I call this a daily pre-flight self-check. All of us, when you get on the plane, as you get on, you can look to your left and you see the pilots flipping switches, going to check every system to make sure that when you take off, everything is safe. So when you get up in the morning, you should check your energy, assess your mood, your sleep patterns, evaluate your appetite, your weight changes, breathing and chest comfort. Look at your legs and feet to see if there's any swelling. See if you can feel the bottom of your toes. And if you have any new or unusual pain that is there. Dr. Hines, the next slide.
So in addition, check on when we're talking more specifically about your heart and circulation, some of the things that you can do are to do at least weekly blood pressure checks if you are set, and also monitor for irregular heartbeats or palpitations. You can do that with your smart watches or just check your pulse yourself. Look for any shortness of breath, chest tightness, or arm discomfort as well.
You take the next two slides if you would.
Sure.
Next slide, Sam.
So some of those same symptoms that we just discussed can have a relationship with long-term risk for heart disease in the future. So when we look at the 5-year mortality rate, or across 5 years, what is the increased likelihood of passing away if you have those symptoms? There is a 15% mortality rate if you are experiencing chest pain, chest tightness. There is a 25% mortality rate if you're experiencing shortness of breath, 20% mortality rate with swelling, in particular in the lower extremities, and a 10% mortality rate with unexplained fatigue.
Is that
And
Lawson?
essentially, these symptoms are broad enough that they are, suggesting that something is going on and there is something that needs to be checked out.
That's very important. Is Dr. Lawson on? So let's look at the next slide. The importance of early detection is very important. And if you look at this slide, early detection correlates very much with not dying. The next thing is important is to look at if you do it late, you see that the survival rate is not nearly as much. So it's very important to have early detection of your diseases. Next slide. So there are major risk factors. High blood pressure and obesity remain the most common problems and drivers of mortality. Want to take this, Dr. Hines?
Sure. Um, Major factors that can contribute to an increased risk of having significant heart disease, high blood pressure. There is a 30% prevalence of having high blood pressure, increased risk of having high blood pressure and heart disease. There is a 20% increased risk with diabetes. There is a 25% increased risk if you are a smoker, a 35% increased risk if you are obese, and about 27 or so percent increase if you have high cholesterol.
Next slide, Simon. That's a blank. Go to the next one, yeah. So you want to check on your feet and your legs to see if there's swelling. There's fluid accumulation in the feet. This suggests that you have heart failure or vascular disease, one of the two. And it also suggests that you might have right-sided heart failure, meaning not the left side that normally pumps blood to the body, but the part that blood comes up from the liver into the heart and it gets blocked. And that will cause systemic venous congestion. That's very important. It can also result from kidneys or liver disease. Next slide. So also, if you look at a person or yourself, you can see if you have jugular vein distension, that's in your neck. If you're bulging, this indicates right-sided heart pressure. That's very important. And again, you want to see your doctor if that happens. If you see heart failure from that, pulmonary hypertension, and pericardial effusion, if there's water around the sac around your heart, that's called periventricular or pericardial tamponade, if it makes the heart not beat as good. Next slide. If you have shortness of breath, which is called dyspnea, so fluid in the lungs from left-sided heart failure, it can cause breathing problems, especially. The symptoms get worse when you lie flat, and sometimes you have to prop yourself up on pillows. That's called orthopnea. That's a problem at night. So you want to, if you have to sleep on pillows, that's not good. Next slide. That's Hines.
Fatigue and exercise intolerance. So if if your heart is not pumping effectively and you have a reduced cardiac output, that is going to decrease the ability for your heart to deliver oxygen to your tissues. And this is common in heart failure, cardiomyopathy, and irregular heart rhythms or arrhythmias. And what that looks like is being tired extremely quickly, or an exercise tolerance that doesn't make sense, right? Like not being able to move or do things that you would expect to be able to do without being short of breath.
Okay, you can take the next one too if you want.
Finger clubbing. So that's going to be a bulbous enlargement of your fingertips, or your fingertips will be rounded, almost like there's like a balloon on the ends of them. And this is seen when you've been having a long time, usually, without getting good blood flow to your distal extremities. You see this especially when someone has congenital heart disease or a cyanotic heart disease. That means it is a heart disease that is specifically not allowing the blood to be reoxygenated, and chronic hypoxia, which is a chronic low oxygen level. Used to see this more in people with emphysema, right? Especially back when oxygen tanks weren't nearly as available as they are now.
Okay, next slide, Simon. So there's some skin signs that we want to talk about. Livedo reticularis. It's a net-like purple discoloration on the legs. It happens in some people. It could indicate cholesterol emboli, vasculitis, or autoimmune disease. Next slide. Some people have these yellow pads or deposits near the eyes, the outside or the inside. And usually that can be associated with a high cholesterol or high LDL, which is a bad cholesterol that is put you at risk for a heart attack. It can also give you a look at you may have premature coronary artery disease, which again is pre-heart attack. Next slide. So also, if you look at some people, there's something called corneal arcus. And it's a gray ring that's around the iris of the eye, the part that opens and that dilates or constricts. It's concerning if it happens less than 45 years old. It can be associated with familial hypercholesterolemia, or high cholesterol in your family. Next slide. Dr. Hines?
Pale conjunctiva. That is when the inner eyelids are pale, and that can indicate anemia. And this is also indicative of a low hemoglobin level or worsened cardiac workload.
Next slide.
Nail signs or Quincke's pulses. This is a visible pulse in your nail beds, and this suggests aortic regurgitation or when you have a wide pulse pressure, that is also can correlate with that.
Next slide, Simon.
Splinter hemorrhages. These are all also findings that you're going to see in your fingernails, and there will be thin, dark streaks under your nails, and that is seen in endocarditis and vasculitis. Also, just point out though, for people of color, if you've had those thin kind of melanated lines in your fingernails for forever, right? That's just you. It would be like if these popped up normally. I mean, new, if these popped up as new.
Okay, next slide, Simon. So there's some common medications for the heart, and we want this to be easy to understand. So, one, blood pressure medicines. They help your heart pump easier. Water pills are known as diuretics, and these reduce swelling, and they also help your fluid build to stop your fluid balance build up. Cholesterol medications are very important. They keep your arteries from hopefully clogging. Aspirin, if your doctor recommends it, it helps keep your blood fluid. It's an anti-thrombotic agent. And also beta blockers, which you have to be careful about, but that slows the heart down and lets it work a little bit less hard, especially if you had a previous heart attack. And ACEs and ARBs, which are medication that dilate your blood vessels, these protect the heart and the kidneys. Next slide. That's Hines.
Lifestyle changes that protect your heart. So, one, eat more vegetables. So, fruits and lean proteins. And we've discussed these types of dietary recommendations many times on this show. Reduce salt. So, too much salt raises your blood pressure. And particularly if you're a person of color, we tend to be a little bit salt sensitive, and that also, as far as retaining fluids in that space. Move your body at least 20 to 30 minutes a day, most days of the week. Avoid smoking as well as secondhand smoke exposure. Limit your alcohol and sugary drinks. Sleep 7 to 8 hours every night, and manage your stress with things such as walking, music, meditation, prayer, deep breathing. Um,
Okay. So I'll do the male, you do the female.
sure.
Okay. So male self-exams. Testicular check. So it should be at least a monthly exam that you perform on yourself after a warm shower. You roll your testicles gently between your fingers. Look for lumps, heaviness, or swelling, or a painless lump is a warning sign. Is a warning sign. Next slide.
Female self-exam, breast health. So you want to do monthly exams, usually around the same time in your menstrual cycle. So if you do it on the first day of your menstrual cycle, always do it on the first day of your menstrual cycle, because your breasts do change depending on where you are in your cycle. You want to be looking for any lumps, dimples, skin thickening, any nipple discharge, any asymmetry that is new or different, and report any changes that you find promptly to your doctor.
Next slide, Simon.
Skin, nails, and visible signs. So, if you just see any new moles, any new dark patches, any new nail ridges or new discoloration, if there is a yellowing of your eyes, sometimes that can be indicative of liver issues. Um, Unexplained hair loss patches. Sometimes that can be indicative of an autoimmune issue. Again, the key thing that all of these have in common is if there are new unexplained things going on with your body, and the explanation should be something other than I'm just getting older, right? Because none of those things are I'm just getting older.
I'll take the next slide, Simon. There's a warning sign that may tell you need medical care. If you have chest pain or shortness of breath, check it out. Don't just say it's indigestion. If you have any sudden weakness, especially if it's one-sided or a leg or an arm or even your fingers, if you have any fainting at all, it should be checked out. If you have any severe abdominal pain, blood in the urine or stool, if you have any rapid weight loss, get medical attention. Next slide. Dr. Hines.
So here are the takeaways. Know your body's normal patterns. You've been with yourself for quite some time. So start paying, if you haven't been paying attention before, get to know yourself well enough to be able to recognize some of the things that your body does. And so that then you'll be able to catch those small changes because small changes are what's going to come first so that then you can get to early detection. So those small changes matter. Doing self checks in some of the ways that we described here are going to be helpful in detecting something early. And as you saw, and as you've heard multiple times, the earlier you find a problem, the more likely we are to be able to address it. So seek medical care early. You don't have to answer all the questions yourself. That's why you have your trusted primary care provider and understand that health is your greatest wealth and cherish it as such.
Yes, sir. Next slide, Simon. So what to do if you notice symptoms? You want to read that, Dr. Hines? It's a little bit small for
Sure.
me.
Do not ignore chest pressure or shortness of breath. There is a tendency we all have to think that there's nothing wrong, like it's a natural bias, right? But sometimes there is something wrong. So if you're having chest pressure, shortness of breath, unexplained sweating, stuff's going down to your arm, yeah, go get that checked out. Write down when symptoms are happening and what you're doing when you're getting some of those symptoms. That pattern can be very helpful in giving your provider some direction in how to investigate your symptoms. Call 911 for severe chest pain, for severe trouble breathing, for any type of passing out, fainting, and follow up with your doctor quickly for any new or worsening symptoms that were not emergencies.
Simon, next slide. So why you want to take your medicine every day? I know people take a medicine if their blood pressure is up or how they feel, but if you take your blood pressure medicine every day, that keeps your pressure normal. And if you remember, that's one of the things that can cause a high risk factor. One also that prevents worsening heart failure if that's the problem. Also, it reduces the risk of heart attack or stroke. It also stabilizes symptoms like swelling or chest pressure. Skipping doses increases danger. Next slide, Dr. Hines.
Lifestyle changes for heart health. So, especially as we go into the holiday season, right? And all of the bad options are going to be right there for us. In between those holiday meals, try to choose the baked or the grilled foods instead of the fried foods. As we spoke about earlier, reduce your salt intake. and you're looking at anything that comes in a package or that was already made, you're going to assume that that has a higher sodium count, right? Stay active. Find ways to get those 20 to 30 minutes in a day, even if it's not all at the same time, right? If you break it up, if you've got 5 minutes here, if you've got 10 minutes, find as best you can some ways to just keep moving. Avoid smoking. And limit your alcohol again, especially as we go into the holiday season. Lots of times the parties and the alcohol is flowing. Just so be mindful of what you're actually consuming, right? Pay attention to yourself. Drink more water, and eat fewer, and drink fewer sweet drinks, and do your best to get those 7 to 8 hours of quality sleep.
So Dr. Hines, my family is West Indian, Jamaican. And so that rum punch is gonna be hard to stay away from.
Again, so one of the things that you can do is if you have a glass of rum punch, have a water after that, right? Like you can stack good habits. So, I'm not going to have another rum punch until I've had a glass of water. Find some things to make it more reasonable. Because to your point, it might be silly to set a goal not to have any at all, right? For somebody that is a reasonable goal, but for somebody else that's not a reasonable goal. But how can I do better, right?
Hey, I appreciate the suggestion. I had a
Yep.
glass of water. Give me next slide, Simon. So choose baked or grilled foods instead of fried. Reduce the salt intake. We keep saying that. Stay active 20, 30 minutes a day. Avoid smoking, limit alcohol, and get your sleep. But also take a short walk after your meal. So we should go out and walk after that big amount of turkey. Use stairs when possible. Stretch every hour. Add vegetables every meal. And some people suggest eat vegetables first. I don't know how to do that. Let's go to the next slide. You want to take that, Dr. Hines?
So heart healthy Thanksgiving meals. So an herb roasted turkey breast is a heart healthy choice. Mashed cauliflower instead of mashed potatoes, or light sweet potatoes. Green beans sauteed in olive oil. Whole grain stuffing with vegetables, and fresh cranberry relish with little sugar. I have to say, so few of those things. If you brought that to the family, if that was your contribution, you depending on who you're with, you might get talked about. Test some of those recipes out before you take them to your family gathering.
You don't want to get thrown out, right? Let's talk about take the next one, heart healthy Christmas.
So, as we're thinking about Christmas as well, so some heart healthy Christmas meal ideas: baked salmon or lean roasted meats, Brussels sprouts with garlic and olive oil. Brussels sprouts have really made a comeback in the last 7 years. Brown rice or quinoa stuffing, roasted vegetables with herbs, fruit based desserts such as baked apples. And again, we have time for Christmas, right? Try it out first, right? Tweak it, make it good. All of those things have potential. You're just gonna have to present it well.
There you go. I'll take the next one. Holiday eating tips. Start your meals with vegetables. Eat slowly and enjoy the flavors. Chew slowly. Drink water before and during meals. Avoid second helpings. That's going to be difficult. Limit alcohol. That'll
So
be easy.
I think you can do that same, you can use the same technique. We do that at my house in general, right? Before you go back for your second plate, you have to get a glass of water, right? Like a real glass, not a baby glass. And if you still want to get the plate, go get the plate, right? Right, but you have to drink a glass of water in between.
Very good. I appreciate it. Anything in the chat for us to talk about? Any
No, not yet.
So is Carl Brooks on? Is Carl Brooks on, Simon?
I don't. Yes, yes.
I want to ask his wife, what are you having for Thanksgiving? Miss Drina Brooks?
The
Wait till,
camera's not on, and they're muted.
okay. Is Dr. Gibson on?
Dr. Lawson's here.
Hello, Dr. Walks. How are you?
Very well, thank you, sir.
I had some beautiful pictures from down under.
Oh, look forward to that.
Excellent. So we might be able to get done early, but you're going to have a good Thanksgiving dinner. What are you going to have at your house?
Well, I'm going to, unfortunately, first of all, Thanksgiving is my birthday. I'm going to have to deal with two problems. Um, I think the point that you didn't mention is that holidays is a time when a lot of people say we can break the rules. That is that we can just say the heck with it. And of course, it will be very tempting to eat Thanksgiving turkey, which I got planned. I actually prefer duck. But also, and my wife was thoughtful enough. She said, well, we're having turkey and all that. So maybe we should avoid the birthday cake this time.
As I tell you, Dr. Hines said you can make a no sugar birthday cake.
But I just said I was putting a note in here. I just want to know that, and also I just want to point that there's a colleague of mine, Harry June, who's now deceased, did a series of studies showing that intermittent alcohol, i.e., binge drinking, can be just as bad as regular drinking. And also, just wanted to also make the point that a lot of us treat different problems with food. So we have this whole concept of comfort food. I'm down, I'm despondent. Let me go and eat me some chocolate cake with ice cream on top of it, or some other goodies, and then that'll help deal with my depressive symptoms. Alcohol is a lousy sleep medication, and yet folks get excited and get involved, and so they go out and drink to go to sleep, but it has a short half-life, and so you end up actually sleeping less than if you got a good night's sleep with moderate drinking. So all your points are excellent ones. Just want to note that just because it's the holiday season doesn't mean you take a vacation from health.
Simon, take the slides down.
That's a really good point, Dr. Lawson. When I used to work in the emergency room, um, it was everybody always knew working on the holiday was, okay, an inconvenient, right? Because you wanted to be with your family. But whoever was working the day after the holiday, oh man, that's when you were gonna get it. Because that's when people who had left their medicines at home and they had taken a break from their healthy eating, ate all the salt. That's when all the congestive heart failure patients were coming in. Like the day after the holidays, that's when you were gonna get it. For the reasons that you just pointed out.
Mhm. Is
I
Dr.
don't know if
Johnson?
we're going to have another session on holiday blues, but I just want to note that I'm sure many of you have your patients taking their PHQ-9s and their GCGs, screening for depression and anxiety. Just wanted to note that when you get word, if you have depression symptoms, anxiety symptoms for over several weeks, most of the day, get some medical attention.
All right. Well, thank you.
Carl Brooks is unmuted now.
Who is? Carl?
Yes.
Carl Brooks or Adrena Brooks? What do you have for Thanksgiving dinner?
No, Carl is a seafood person. He won't eat the turkey. It's either baked salmon or stuffed bluefish.
Excellent. I'll be
He's
right.
really good that way. He eats a salad every day.
All right. Thank you so much. Anybody have a favorite recipe they want to share?
I want to hear about stuffed blowfish. I've never heard of that.
Stuffed
Bluefish.
blowfish?
Stuffed bluefish.
Oh, got it. Sorry.
Yeah,
Yeah,
here's my daughter.
blowfish in Haiti, right?
I was like, hey.
Now, here my daughter are what do you call them? The pescatarian.
Pescatarians.
Pescatarians, yes.
Okay, thank you, Ms. Dorina.
You're welcome.
I noticed that my other psychiatric colleague is here, and he'll tell you that I'm a big fan of eating good old game animals because they tend to have less fat, fewer carbohydrates. So I would try to substitute bison for hamburgers as much as possible, and also eat good old elk meat every chance I get, and we'll have a rabbit or a squirrel or two. Um, make sure that it's the right season because we know that there's certain of these animals unfortunately carry the wrong kind of parasites, as well as we now know that some deer in the local area actually have a slow virus. But other than that, they can be excellent substitutes for the usual over carbohydrated, over refined meats that we have in terms of the beef and turkey and other dishes.
Excellent, Dr. Lawson. Is Dr. Dawes on from Jamaica?
No.
Who else is on we can call on? You see somebody, Dr. Hines?
Juliana Taylor.
Oh, listen, Miss Taylor, tell us what you're having. Can you unmute Miss Taylor?
I knew I was going to be called on.
Yes, indeed.
Professor. Actually. Well, my niece announced that she will be making some of her special, some type of sweet potato pudding, something like that. My nephew will be making his macaroni and cheese dish. I love turkey. I'll be having a little bit of turkey. My mother usually cooks that, my 92-year-old mother, with a couple onions inside of the turkey cavity, which makes it really, really tasty. But I also tend to lean toward fish, especially salmon. Hopefully, my sister will be serving salmon as well, or some other type of fish. And
Excellent.
lots of vegetables. Yes.
Excellent. Anybody else on? Is Dr. Gibson on? I know he cooks.
Nope. Let's see. Linda Hall, Pat Walker, Hazel Tanner, and Jan.
And who?
Jan.
Okay. Miss Walker? Miss Tanner? What do you have for dinner? Are they unmuted?
Not yet. It's nice to see so many people. Oh, there we go. Miss Tanner's unmuted.
We're gonna have a fried turkey. My daughter's making sweet potato pie. And from New Orleans, my brother has a New Orleans special dressing that we have, and probably some millieton, the squash, and some gumbo.
All right. All right. Anybody else?
Juliana Taylor said Popeye's Cajun turkey while she's on vacation from health.
It's on vacation from
No, it wasn't me.
No, that was me.
Sorry, Linda Hall.
Miss
Sorry,
Hall.
sorry.
Yes, that's all right.
I'm on a total vacation
But all right.
for health and statin watches and all of that.
No, you're not.
I want to eat everything.
But you do
But
not
I'll eat that one day.
do not want to have a permanent vacation, so be careful.
Right. No, it's just gonna be that one day.
Okay. Dr. Hines, what did you say about the day after?
Well, I was just saying how when I worked in the ER, that's when everybody's bad habits caught up with them the next day, right? Like, or the medicines that they forgot to bring, when they traveled to their in-laws' house, and all that kind of stuff.
All right. Well, I appreciate everybody for being with us this Sunday. Dr. Lawson, any final words?
Yeah, again, I think he made some excellent points. And unfortunately, people tend to find the easy way out. I just had a friend of mine who gave me what he called this exercise program called roll your eyes to the right, roll your eyes to the left, and up, and move your head there. And he said doing that for half an hour was his exercise program. I will not go into the status of his health and why he still weighs 300 pounds and 4 or 5 feet tall. But again, I think that's excellent advice. Preventing health problems is probably the most effective and efficient way to enjoy life, rather than wait until the last minute, overindulge, and then try to reverse the damage that you've done.
Okay, Dr. Hines.
Well, first I want to say happy early birthday, Dr. Lawson. We hope you and you have multiple birthday wishes in the chat, but I hope you have a wonderful birthday.
Thank you.
And my last words are around, in support of what we talked about today. Set some reasonable goals for yourself, not just for Thanksgiving, right? But these next few weeks, there's a lot more social gatherings and things going on. Set reasonable goals for yourself. Because sometimes if you go, oh, I'm not going to have any at all, right? The mental energy that you spend trying to not have any at all, right? You might mess around and ruin the good time that you could have had with your friends and families and loved ones because you were preoccupied about not eating X, Y, and Z. And then have a glass of water. That's my other tip. Have a glass of water. Whatever it is, have a glass of water before you do it. Have a glass of water.
There you go. There you go. So my final words, I agree with everything that Dr. Lawson and Dr. Hines have recommended. And we'll remember to drink that water right after I have a rum punch. Everybody enjoy their Thanksgiving and their Christmas and enjoy the rest of your day. Thank you, Simon. Have a good day.
Bye.